Let's talk about poo. Yes, really. Because doing a simple poo test at home could help save your life. This is called Bowel Cancer Screening, and it's for people aged 50 and over. Your bowels are part of your body that turns food into poo. The test checks your poo for tiny bits of blood you can't see, which might be an early sign of cancer. The test is called a fit kit, and it's easy, free and done in your own bathroom. Bowel Cancer Screening helps people stay healthy.
I got this in the post, something to do with poo.
Oh, okay. It's your bowel screening kit. I've had one of those. It's a little bit gross, but also a little bit hilarious.
They want me to post my poo. What happened to the post he finds out?
Trust me, they've seen worse. It's just a sample. You just put it in a tube, send it off, and they've got it.
I can barely look at it, never mind scraping.
You don't have to love it. You just have to do it because they may find something serious.
Okay, if the postie sends one back, I'm blaming you for it.
Here's how it works. 1. Catch your poo. You can use toilet paper, a clean tub or even cling film over the toilet. 2. Use the stick in the kit to scrape a small sample. 3. Pop it in the bottle, seal it and wash your hands. 4. Post it back in the free envelope. Job done. No stamp, no fuss, just your poo in the post. You'll get a letter with your results in about 2 weeks. Most people are told everything's okay. If they do find blood, they'll invite you for more checks. That doesn't mean you have cancer. It just means they want to be sure. And remember, if you ever notice anything unusual, like blood in your poo, changes in how often you go, tummy pain that won't go away, or losing weight without trying, don't wait. Talk to your doctor. Bowel cancer is easier to treat when it's found early. So go on, do the test. Laugh about it if you like, just don't ignore it. It's your choice, but doing it could save your life. Questions and answers.
How exactly do I know that I've done the test right?
Well, usually the test comes with clear instructions, and the clear instructions will essentially talk to you about how to do the test, etc. What you will then receive the result in the post with the outcome of the test. If the outcome is actually we need to repeat it again, they will then send you the kit again to ask you to repeat it again. But more often than not, you'll find that the testing kit will actually have clear instructions on it, so it's quite straightforward. So there shouldn't really be a reason as to why you'll get things wrong, but things do happen. But you'll be notified of that in post.
What is the test really looking for?
So the test is actually looking for tiny amounts of blood inside your poo that you can't see. Sometimes this can signify something going on with your bowels or with your gut, or sometimes it can suggest something a bit more sinister like bowel cancer.
What happens if the test finds blood?
If the test came back positive that there was some blood in there, then naturally the specialist would want to have a closer look at your bowel. The way we do that is by inserting a special camera into your back passage to have a look at your bowel in more detail. Now this is called a colonoscopy.
Could I have help doing the test?
Absolutely, yes. By all means, ask family, ask friends, ask your GP surgery. And also on the bowel testing kit, there's a telephone number on there as well. And they can also offer you some support in how to actually do the test.
How do I know that I've done the test right?
Well, there are very clear instructions on the bowel testing kit as to how to actually do the test. You'll then receive a letter in the post once you've done the sample and sent it off, and that will come back with the result. If it comes back that they were unable to check the sample for whatever reason, they'll send you another testing kit asking you to repeat it again.
Will I always get posted the kit every 2 years?
Yeah, so the bowel screening program usually is every 2 years. Some places it starts as early as the age of 50 years of age. but generally speaking, yes, it's every 2 years.
What should I look out for between tests?
Things to look out for would be things like if you notice any blood in your poo, if you notice that your tummy is getting bigger and for whatever reason you're not sure, or if you notice that your bowels are being a bit funny and you might be going a bit more regular or maybe not as good as much as you used to, which is unusual for you. You might notice that you're experiencing weight loss for unexplained reasons, so your clothes might not fit you, or if you're just feeling generally tired and not feeling yourself, then make sure you get yourself checked out. See your GP or contact 111.
Thank you.
Bowel Cancer Screening helps people stay healthy.